My name is Jennifer. We're at Homerton Hospital and we are going to be talking about the OPAT service, which is the Outpatient Parenteral Antibiotic Therapy Service. The service was set up with the aim of getting patients who are medically stable out of hospital so that they can finish their IV treatment at home.
The condition I've got that requires me to have IV drugs is called semi-invasive Aspergillosis. It's essentially a fungus that's got into my lung and made a hole there. It's treatable but not curable, so I have to live with it all the time. The impact that's had on my life is that it's very unpredictable and it's quite frightening. I've gone from being somebody who was very fit and never had to think about being ill to being somebody who's had to really organise their life around constant kind of cycles of medication.
Fran was referred to us in November last year. The plan was for her to finish her antibiotics at home.
Every 7th week, I have to have a week of IV antifungal medication.
Because she is mobile and independent, she wasn't suitable for district nurses to come to see her because of their workload and limited resources. They are not able to see patients who can get themselves to the hospital daily.
The whole idea of self-administration was put to me when I was an inpatient, and it was part of my discharge planning.
As soon as the self-administration is approached, we explain to the patients how it will work. So it's never a case of you're shown once and then off you go. It's a case of I'll show you, I'll do it with you, and then I will watch you. And at that point, I will always intervene if something hasn't been done right or if there's a better way of doing things.
I was really amazed to find that it was an option to have it at home. And what I thought that would mean would be that a nurse would come round and give it to me. But during a conversation with the clinical nurse specialist, it turned out that I was the sort of person who might potentially be able to do this at home on my own once I've been taught sufficiently how to do it. So this is the very precious thing, the antifungal medication. And then around me are all the bits and pieces that I need to get set up. I've been taught very well by the team here and by a clinical nurse specialist. Lots of tips about how to be as well prepared for this process as possible. It's one thing to do this in a hospital setting and quite another to do it at home when you've got an 8-year-old and an 11-year-old asking you where the PE kit is. What I found difficult was not knowing what to expect. I now find it really very easy.
I think patients being able to take control at least one aspect, so they are no longer thinking of themselves as the patient as being sick. They're actually proactively doing something to help themselves. I explain about the risk of infection, so not touching key parts, and so they are very wary of that. I think sometimes being in the hospital, you have a nice clean area.